So we're still talking about anastomosis, drains, and diathermies. This is the third section in which we'll deal with the diathermy. In this section, we'll talk about the principles of diathermy themselves. We'll see what they are and how do they operate. Then we'll see the effects of diathermy on the human body. We'll talk of the complications that might occur due to the use of diathermy, and finally we'll see a phenomenon known as capacitance coupling by the use of diathermy in laparoscopic surgery. So let's get into it and see what this actually is. So the principles of diathermy. First, referring to the figure, this is the diathermy unit. This is the diathermy probe. This is the active probe, active electrode. There are two types of diathermy. We'll talk of both the types when the time comes. This is the active cable, the active electrode. This is the dispersive cable, and this is the passive electrode or the patient plate. Now again, this is the diathermy unit, and in this type of diathermy both the electrodes are active, and when they are merged together, the diathermy or the principle of charring, they actually take place. Now what happens during diathermy? What are the principles? There's passage of current through the conductor plates. Now this passage of current, it produces heat. And this production of heat, it depends upon the intensity and waveform of the current. That is, greater the intensity, greater the current produced. Now the electrical properties of the tissues through which the current is passing. Obviously these properties are relevant to the tissues, whatever type of tissue might be there. Now the relative size of two electrodes, again a direct relationship. If the greater the size, the greater the size difference, greater the current that passes through them. Now, there are two types of diathermy, the monopolar diathermy and bipolar diathermy. We have talked about it before. This is the monopolar diathermy. This is the bipolar diathermy. We'll see what the monopolar and bipolar diathermy is. So, this is the monopolar diathermy, in which there is a single active electrode and there is a patient plate. So this type of diathermy is the most commonly used type. The alternating current that is produced by generator is passed through this to the patient. So this diathermy unit is producing alternative current that is passing through this probe into the patient. Now this patient plate is responsible for collection of that current. This plate is very wide. The reason of this plate being wide is that the current might be distributed within the human body and collected from different points, not from a single point, so that the body might not be zapped or charred throughout. Now the current passes through the tissues. Here you can see the current is passing through the tissues and it returns via the large surface plate. This is the large surface plate. Now concentrated current produces heat at operative site. So since at the site of the active probe the current is concentrated, so this produces heat. This heat is collected by the large surface area electrode. Here you can see this is the large surface area electrode, and this is collected from a wide area. Collection from a wide area decreases the concentration of current and produces lesser heat. This lesser heat prevents any damage to the body. Now the bipolar diathermy, again this is the diathermy unit. Here you can see. Now this is the active cable. Now bipolar diathermy has two active probes. Now both the active probes are handheld, and when they're clutched together, that is when the diathermy is activated. So there are two electrodes which are symbolized by forceps limbs. Here you can see the two electrodes, the forceps limbs. Now current flows between the forceps ends. Whenever they're pressed together, there's flow of current between them. Now as a result of this, the only tissue between the forceps limbs, it heats up. No other tissue is heating up, only the tissue which is held between the forceps, it heats up. It is used when essential, that is when you have to pinpoint the use of your diathermy so that no other tissue surrounding that area is damaged. You use the bipolar diathermy. It is used to keep the surrounding area free from any current. So the use of bipolar diathermy, it prevents any damage to the surrounding area. In monopolar diathermy, the current was collected through a widened plate, though that plate decreased the concentration of the current. However, there were some changes made in the surrounding areas. But in bipolar diathermy, only the tissue that is held between the forceps undergoes diathermy, and the rest, the surrounding area, it is completely off the grid. It does not get any damage. So this was all about the two types of diathermy. Now let's see what are the various effects of diathermy on the human body. So it is used for coagulation. So what does it do? It heats up the body, and heating up produces the coagulation. Now it is also used for fulguration. In fulguration, you produce the coagulation at a rapid pace. And finally, it is used for cutting. So the water is lost and destroyed, and the tissue is charred, and this is how it cuts. This is the cutting effect of the diathermy. So in coagulation, there's sealing of blood vessels. So there's rapid denaturing of proteins. This rapid denaturing of proteins due to heat result in sealing of the blood vessels. There's coagulation of plasma proteins itself. There's stimulation of the clotting mechanism due to damage to the vessels. However, the probes, they usually prevent the attainment of boiling temperature within the tissues, because if you attain the boiling temperature within the tissues, a cascade of disastrous effects would occur, and that would damage the body extensively. So the current which passes through the diathermy probes, it is kept in mind, so that it is kept in check so that the boiling point temperatures are not achieved. Now in fulguration, there is destructive coagulation. That is, there is extensive coagulation of tissues with charring as well. It is done on a higher voltage when you have to cut through the tissues, deep extensive cutting, and a high voltage is used for this purpose. Now for simple cutting, it is used to divide the tissues during a bloodless surgery. So now, why is it bloodless surgery? Because you're being very careful. You're slightly coagulating any points, any bleeder points, so there's minimum blood loss, and you're going through the planes of the body. When passing through the bodily planes, it prevents extensive damage. So you're going through the bodily planes, preventing any bleeders from occurring or happening. So this is a bloodless surgery. There's explosion of cell water into the steam. So the principle of cutting is what happens is heat is applied to the cell. Now the cell water, it explodes into steam, and the cell is destroyed, and this is how the diathermy is used for cutting. Now, what are the various complications of diathermy? So first of all, the electrocution. So electrocution, the biggest complication of diathermy. So you should minimize the risk by knowing the principles of diathermy, by knowing what type of diathermy is being used in your operating table, by making sure that your patient is in the sufficient position, by making sure you're not pressing the diathermy probe when you're not there, or when the diathermy probe is not being used, by making sure there are no loss of insulation on the diathermy probe, by making sure your instruments are not touching each other. So you should have regular visits from the safety department, regular visits from the instrument maintenance department, so that your instruments are up to date. There's no loss of insulation. Your team should know how to place the diathermy probes. In case of a monopolar diathermy, you should make sure only you are pressing the diathermy, so that there's no electrocution of the patient. Mind you, you're liable for your patient's safety, and if that occurs, it can be challenged in a court of law. Now, explosions can occur. Explosions can occur by ignition of a gas or fluid. Now, alcohol-based skin preparations are usually avoided because these can catch fire in the presence of diathermy. So whenever you have to use an alcohol-based skin preparation, it's best if you don't use it. However, if you're using it, make sure you are not performing diathermy anywhere near it. Now, it can cause burns. Now, we've talked about it in principles of diathermy, that diathermy is responsible for the production of heat. The diathermy works by the production of heat. Now, excessive production of heat can result in burns. So, if there's faulty devices, if your instruments are not insulated properly, if your instruments are touching each other during your procedure, or the insulation on your instruments is weak, you can damage yourself and your patient as well. Another important point is sometimes a patient gets earthed. So the passive probe of the monopolar diathermy, instead of that earthing the diathermy unit, the patient comes in contact with the table with the metallic arm or something, and the patient becomes earthed, and the current passes an undesired route, and this can result in burning of your patient. Now, another important aspect, the pacemakers. Now, pacemakers are electrical devices, and in diathermy we're using electricity. So diathermy can jumpstart, not exactly jumpstart, your patient is already on a pacemaker and that is working perfectly fine. It can affect the function of your pacemaker. So while using diathermy with the pacemaker, try to use it as far away from the heart as possible so that the pacemaker current would not be affected. However, there are some pacemakers which have the ability to reboot themselves if there is some electrical shock or interference to them. Your anesthesiologist must always be prepared so that if there is any problem with the pacemaker, he might be able to resuscitate and restart the pacemaker and resuscitate your patient as well. So during a laparoscopic surgery, the diathermy can be hazardous. Why is that? You have a very small view of the field in laparoscopic surgery. Say you have your probe, or you have your diathermy probe within the human body, not within your surgical field, however within the body, and somehow that gets pressed. Now this probe can damage whatever area it is touching. So you should be very careful that during your laparoscopic procedure, any instrument that is not being used must be retracted out of the body. If it is there, you should know where it is. It should always be within your surgical field and should have a clear idea of what is going on. Never press your diathermy probe before first finding it. Now, make sure your diathermy probe is not touching another instrument, another laparoscopic instrument, because when it's touching that instrument, it can also cause disastrous effects. Now, channeling can also occur. It is caused by coagulation of tissues, for example, coagulation of penis or spermatic cord during circumcision, so it is best advised that not to use diathermy at all, but if you have to use it, use the bipolar diathermy. So what is capacitance coupling? So what happens during the laparoscopic procedures? A capacitor is formed, and let's see how that capacitor is formed. So this is a phenomenon in which a capacitor is created by having an insulator sandwiched between two metal electrodes. So what happens? This is the metal electrode. Here you can see this is a metal electrode, this is the diathermy hook, and this is the insulator in between. So this insulator becomes the capacitor. It is being continuously induced by the current that is flowing outside and the inside. So this insulator becomes induced and this becomes a capacitor, and this can cause damage to your body. Now it occurs with the metal laparoscopic port and passing of the diathermy hook through it. So this is the metal laparoscopic port, and this is the diathermy hook, and this is the insulator material in between. Now it can damage intraperitoneal structures. Here you can see in this metal laparoscopic port is induced by the capacitor, and it can cause damage to the bowel where it comes in contact with it. Now this can be avoided by using plastic ports. So a very simple easy procedure, you should use the plastic ports, and these plastic ports cannot be induced and they cannot be turned into capacitors, and since they're plastic, there's no conduction of electricity through them, so they're comparatively safe. Now other reasons for burns include diathermy of the wrong structure. So within the laparoscopic surgery, sometimes you do not get a clear idea of what actually is going on. So for example, there was extensive bleeding and you wanted to cauterize your artery, but the field was not clear, and you were trying to cauterize the artery, but you somehow cauterized some other thing. Now faulty installation of the leads is of disastrous consequences. You should always make sure the installation of your instruments is perfect. You should always have regular checkups of your instruments. They should and the department should make sure that the instruments are up to date. And sometimes there can be some unwanted accidents. Somehow the paddle was activated, a new surgeon, a new member entered your team who did not have a clear idea of the working of the diathermy probe, and somehow activated this paddle, and as a result of it there was damage to the tissue. So you should always try to prevent it, try to maintain calm, and try to control the damage that has been occurred. So this was all about this section. In this section, we talked about the principles of diathermy. The principles of diathermy were based on the usage of electricity to generate heat. This heat was responsible for destruction of the cells. There were three different modes at which the diathermy could be used. It was cutting, it was extensive cutting, simple cutting, it was coagulation. So you could use diathermy for multiple purposes as well. Then we talked about various side effects of diathermy, in which there were electrocution, in which there were fire hazards, in which there were burns. So you should always keep an eye on whatever is going on through your surroundings. Whenever a new member enters your team, you should clearly instruct the new member to follow you in the first few days, so that he gets an idea, a lay of the land, and then he can proceed however he wants to. I hope you liked and understood this section. For further sections, keep watching sqadia.com.